Dr. Solante, you are an infectious disease expert. You're on the vaccine expert panel. What's the latest thinking po and attitude when it comes to a third dose, booster shots?
Well, I think we already made the recommendations before that there are some populations na if there will be waning protection of some of these vaccines, there will be populations that will be at risk of developing severe COVID. And we have identified this. No? One are the elderly population, the 60 years old and above, and those who are immunocompromised. And of course, we always look at the healthcare workers as also highly vulnerable because of this waning protection. And we maintain that level of information and data that hopefully the government will also give and prioritize this population for a third dose.
It's a general public point, and I ask in the sense of, people started getting their second shots, diba, in the first half of this year. And going by yung sinabi dati na, after the 6th month, then of your second dose, then that's when you start thinking about kailangan ko ba. I mean, are we now hitting a phase and a time where this is going to be a rolling concern for people moving forward, whether you got your second shot in April, May, June, July, and so on?
Yes, yeah, correct. No, that's a good term, no, rolling concern, because once you pass that 6 to 8 months after your primary vaccination and you belong to this vulnerable population, then that would be something you have to look into, that you need to be protected until such time you'll be given the third dose. And again, ang iniisip ko dito, what after December or January, when majority of those, kung hindi pa tayo mabibigyan ng third dose, yung mga vulnerable population, then that can be another area where some of these patients will be going to the hospital. Sana naman hindi mangyayari for the infection.
But Doc, how does one determine that the effectivity is already waning? Or do you just count the number of months? Kasi from what I understand, wala pa namang studies on this. So we're all groping in the dark here. How do we wait for those who got vaccinated to start coming in COVID positive before we can make a determination?
Actually, Ed, no, may mga data na talaga na monitor. These are in some countries, no. Basic example is the Israeli data, wherein most of their population, the 60 years old and above, that were inoculated in January, they saw a higher number of cases, breakthrough infection. In fact, some of them developed a more severe infection in June. They were all vaccinated with the mRNA vaccine. So in June, they administered a third dose of that, and they saw in the curve, it drastically decreased the number of cases among the 60 years old and above who got the third dose. And in fact, there was also a drastic decrease in the severe cases among those with these breakthrough infections.
Okay, so sir, with that in mind, so the policy recommendation is what po? 6 months afterwards, those with comorbidities, those who are who are in danger should be getting ready the third dose?
Yes, in fact, most countries now are doing that, no? And these are the selected population, the elderly and the immunocompromised, no? Now, looking at this information and applying this in the Philippines, ang priority pa rin natin is really the giving vaccine to unvaccinated, no? Kasi yun ang importante, because when you want to stop a pandemic, when you want to stop the variants from coming in, you really have to give the vaccine to stop that mutation. That's the most important, no? And even if you will not be giving that booster and then you'll be giving the vaccine to the unvaccinated, that's more have an impact over that in that particular aspect.
Well, speaking of prioritization, what about between the minors, yung younger ones, and yun nga, may mga comorbidities na vaccinated na but will be needing a third dose, siguro starting January. Sino dapat kasi hindi pa naman magbubukas yung schools, sino dapat ang ipa-prioritize natin nun?
Yeah, that's a good point, Ami, no? Sa ngayon, ang priority natin ngayon is giving the vaccine to these minors, no? The 12 years and above. And we're not yet talking about booster for this age group, no? Kasi alam mo itong mga population na to, mga bata to no? And I don't know if booster will really be needed among this population kasi maganda ang mga immune response nito. So I think moving forward, no, yun talaga ang gusto natin na lahat mabakunahan and most likely to prepare them for the possible face-to-face schooling next year.
No, I mean, uunahin ba natin yung booster or third dose dun sa mga immunocompromised nga before finishing the children, the minors? Kasi kung naman ng vaccine sino dapat ipa-priority doon? Pagpasok ng by, let's say, January na pawala na 6 months na.
Okay. Ang pananaw ko dito is that if you're looking more on this elderly and immunocompromised as an important population to protect them to develop the severe COVID, I don't think equity should be a problem. Because when you are saving life and with this third dose that will benefit this group of people, then there should be a separate allocation from the government that these people should also be getting the third dose. And at the same time, giving the vaccines to those unvaccinated, including the minors.